Hello everybody, thanks for stumbling into Resident ENT with myself, Josh Jeremiello. This is a channel for medical students and residents to kind of tune up on their anatomy and other large topics within otolaryngology, or ear, nose, and throat. So this episode is going to be directed towards neck levels, specifically for neck dissections. So just to recap, this is from a prior video. These are the levels of the cervical fascia. And so, when you're first learning about this, the real question is, what the heck is a neck dissection, and how do you know what to take out and what to leave? And it seems really complicated at first, but it's actually quite simple. It's the fibrofatty packets within the neck that contain lymph nodes. And all of those lymph nodes live in between these layers of fascia, of course, deep to the superficial layer of the deep cervical fascia, but among the rest of the deep cervical fascia layers. So just to recap, this orange here is the platysma, and it is contained within the superficial cervical fascia. Just deep to that, we have the sternocleidomastoid muscles, the strap muscles, and the trapezius, all within the superficial layer of the deep cervical fascia. And then within that, we have the visceral fascia. This includes the thyroid, the trachea, and the esophagus. We have the carotid sheath, bilateral. Those contain the internal jugular vein, the common carotid, and the vagus nerve, cranial nerve 10. And we also have the prevertebral fascia, which is going to wall off the spine and this paraspinous musculature from the rest of the inside of the neck. Now, all of this area here that appears blank, within and around these other layers of fascia, is going to be where the fibrofatty packets live, or the areas that contain the lymph nodes that we want to remove in our neck dissection. So the levels of the neck are 1 through 6. We'll really touch more on 1 through 5 today. And are kind of walled off based off of either surgical anatomy or radiographic anatomy. Since we're talking about surgeons, otolaryngologists, ear, nose, and throat surgeons, we'll talk about the surgical boundaries that are used to distinguish. So I'm going to draw some very important structures here. The first one, and bear with me, is going to be, how about we use red? The first one is going to be the anterior belly of the digastric. Okay? That's going to come up this way to be the posterior as it runs into the mastoid, which I didn't draw there. The next one, which we'll draw in blue, because I feel like bone should be blue, is now going to be the hyoid bone. Okay. Next, we have another muscle. It's the SCM. It's also going to attach to the mastoid, come all the way down to the clavicle. And let's just draw it like this. It's a little bit, wider than that, but that's okay. And then we also have the very first strap muscle, which is the Elmo Hyoid. That's going to come all the way up high from the hyoid and come down all the way to the scapula. And there's a little fibrous part to it there. And then finally, we'll draw this one in green. We're going to have a very important nerve within these levels, which is cranial nerve 11, or the spinal accessory that controls the SCM and the trapezius behind it. Okay, so as we look to start naming our levels, we have to, be understanding of our structures. So in between the bilateral bellies of the anterior belly of digastric is going to be our levels 1A. So some would state that there's really only one 1A. There's not two. There's not bilateral. It's just one nodal packet, and that's what most surgeons ascribe to. You know, there's one other structure that I had forgot to mention, and that's going to be the posterior border of the SMG, or the submandibular gland. Now, on the posterior side of the anterior belly of the digastric, all the way to the border of the posterior border of the SMG and above the hyoid bone is now going to be your level 1B. Posterior to this is level 2. However, we like to ascribe that level 2 actually is level 2A and level 2B. And so our border there is actually going to be our cranial nerve 11. So in front of it, we have 2A, and posterior to it, we have 2B. Now, we're also going to use our hyoid bone to separate our level 3 and our level 4. So level 3 is going to start from the posterior portion of the SCM, the sternocleidomastoid muscle. It's actually going to run all the way to the lateral edge of the trachea, and then it's going to stop at this fibrous sheath, or this, excuse me, can't remember the name right now, but the fibrous sheath in between the two bellies of the myohyoid, or excuse me, the omohyoid. So this is going to be level 3. And then below this and above the clavicles is going to be your level 4. All right. Now, posterior to the posterior edge of the SCM, and as we approach what we call the floor of the neck, or really what's more appropriate is the prevertebral fascia, is going to be our level 5. Okay. Now, I know we mentioned we weren't going to talk too much about level 6 because we don't use that for the classic modified radical or selective neck dissection, but you do see it in what's called a central neck dissection. And just to allude to that, it's the central neck. So this is the paratracheal nodes, or the nodes that live next to the trachea, but just basically just below, posterior, although it could be superior and inferior, to the thyroid gland as well. Again, it's really only important for thyroid cancer, so we won't worry about it too much. So again, when we look at the anatomy based off of our surgery, we are first going to, let's just use this image as well. We are first going to make our incision into the skin, and then we have to make an incision along the anterior edge of the SCM to help open up this window to get to all this fibrofatty tissue. And now, of course, this is just one slice within the neck, and it goes superior and it goes inferior, so this picture doesn't make a whole lot of sense for that. But you can see now all these areas that are in between the fascial layers is going to contain the lymph nodes, and that's how we're going to take them out. And based off of retrospective studies and actually prospective randomized controlled studies as well, we have a good idea of where a cancer is in the head and neck, dictating how many of these lymph nodes we should take out. That's a totally different topic for itself, but the most important thing is when you're in there that you're recognizing what the borders are that are being identified. So again, anterior or medial to the anterior belly of the digastric is going to be your 1A. Going posterior to the anterior belly of the digastric, all the way until the posterior edge of the submandibular gland, you're going to get 1B. A lot of times, most surgeons will also take some perifacial nodes from this area. It's a whole other different story into itself. Behind the SMG gland, the submandibular gland, and above the level of the hyoid is going to be our level 2, which is going to be split into 2A and 2B by cranial nerve 11, or accessory nerve, spinal accessory nerve. Going down below the hyoid, we now have 3 and 4, which are going to be separated by Elmo Hyoid, and they're going to stop at the posterior edge of the SCM. Posterior to the SCM and all the way up to the vertebral fascia is now going to be our level 5. And so those are the borders that we use in surgery to delineate which fibrofatty packets to take, because again, once you see them, they're all kind of interconnected and there's not a good real anatomical delineation. So instead, these are the man-made delineations that we use based off of the likelihood of having cancer spread from a certain region of the head or neck. Okay, so I hope that was helpful. Thanks for tuning in. Again, this is Resident ENT, and I'm happy to provide any answers to any questions you have down in the comments below, and I appreciate you tuning in. Have a good day.